Are you a baseball player that's currently dealing with an arm injury and aren't sure about what your process needs to look like to safely get back to throwing and eventually back to playing in games? I'm going to show you today the process that we take all of our baseball players through to make sure that that happens. How do I know this? My name is Dr. Jeff Lewis. I'm the owner and physical therapist of Lewis Physical Therapy and Sports Rehab in Point Pleasant, New Jersey, where I have helped countless baseball players return to throwing pain-free and stronger. So again, I want to go over today the process that we use to get guys back to throwing. Not necessarily not back to pitching, but just back to throwing for the first time after dealing with an arm injury. So whether it's an elbow or shoulder, and this remains the same for whether it's non-operative or a surgical issue. So first thing we want to do, making sure that we are getting full range of motion back in the injured area and we're getting pain down. If we don't address these two things right off the bat, we are not setting ourselves up for success moving forward. So again, if it's an elbow, first thing we want to get back is extension. We want to get extension back immediately. Flexion-wise, if you're a pitcher, you don't need to be able to do this. You're never throwing the ball from here. I typically like to get guys to about, we'll just say roughly 125 degrees of elbow flexion, so right here. If they're still a little bit tight past that, that's okay. It's not necessarily stopping me from moving forward as long as there's no associated swelling there. So that's range of motion, and then pain's the obvious thing. We want to make sure that we're comfortable to an extent as we're going through our exercises. So the next thing I call the rehab strengthening part of it, and that's a lot more of your typical corrective-based exercises, lower intensity work. This is a good time where we add in BFR so we can use those lower loads, but also still get some strength and hypertrophy with it as well. So this is really laying the groundwork more than anything. And we'll put in here stability as well because that's a big part of it. Now, after we have a good foundation in here, I want to get guys into the weight room lifting as soon as we can. That is where we are going to make our strength gains. If we're just doing 2-3 pound dumbbells here and we skip these next couple steps and go right to throwing, sorry to tell you, but you are probably not, your throwing program is probably not going to go very well because you're not actually strong. So we want to get guys in the weight room as quickly as we can, squatting, lunging, pressing, pulling. That's where you're going to get that true strength developed. So that's huge. Once we have a good level of strength and stability, now we get into the plyometrics. This, to me, this is the fun part of rehab right here. We have medicine balls, plyo balls. We're throwing stuff. We get to be creative, stressing the arm, stressing the body. This is all about getting your arm and body ready for throwing. We don't want the first time that you go to throw to be the first time your arm and your body has moved fast. I always tell guys, your first day of throwing should be significantly easier than everything else that you've done here plyometrically, okay? So that's what that process looks like. So if you're a baseball player or pitcher, you're going through the rehab process after an arm injury right now and you have questions, leave a comment below. You can like and subscribe to our channel. We have a ton of baseball content specifically on rehab and performance.